We go to differentials, Western and Chinese medicine. This time we talk about atopic eczema. Western differentiation for atopic eczema. Atopic dermatitis characterized by scaly and itching rashes. Eczema is most common in infants, and at least half of these cases clear by age 3. In adults, the condition is more chronic and persistent. Signs and symptoms: intense itching. There will be blisters with oozing and crusting, erythema or inflammation around the blisters, rash, dry leathery areas of skin, skin soreness and bleeding from scratching. Most common areas affected are skin creases such as the front of the elbows and wrists, backs of knees, and around the neck. Most common areas in infants would be the face and scalp, adults on the hands. Caused by allergic reactions to certain foods like wheat and dairy, overheating, secondary infection, wool next to the skin, cat and dog fur, soaps, detergents, house dust, mites, and pollen. Other triggers: extreme hot and cold, humidity, hormonal changes in women caused by the menstrual cycle and pregnancy. Complications: there is often a family history of allergic conditions like asthma, hay fever, or eczema. Now let's go to Chinese differentiation of atopic eczema. Diagnostic questioning according to the type of eczema. So this would start before age 6 months. Pronounced heat. So we have fetal heat, a pattern specific to skin conditions, excoriation, severe itching caused by heat or wind, scaling, which is a wind, edematous lesions, vesicles, pustules, yellow exudate, yellow scabs, yellow crust, skin erosion. These are all manifestations of dampness, ill-defined macular or papular lesions, heat at the blood aspect with wind, well-defined red edematous lesions. There is heat with damp and wind, dull-colored pale red or brown lesions, spleen deficiency with damp, dry lichenified skin with pale red lesions, blood deficiency with dry wind. Main organs involved: we have the lungs. Lungs control skin, lung, defensive chi system protects against external invasions. Kidneys, because the kidneys nourish and moisten the skin. Kidney essence bound with corporeal soul, the po of lungs, manifesting on skin and responsible for itching and pain. And the spleen, impairment of spleen function leads to damp. And liver. Liver blood cools, moistens, and nourishes the skin. Etiology for atopic eczema in Chinese medicine would be poor diet, excessive consumption of sweet, greasy, dairy, spicy foods, caffeine, alcohol, emotional stress, environmental toxins, exposure to cold and wind, and overwork. Zangfu patterns are fetal heat, heat at the blood aspect with wind, damp with heat, heat with damp and wind, spleen chi deficiency with damp obstruction, blood deficiency with dry wind. Thank you for your attention.